Well, welcome and happy to be here with you. So Maine Community Health Options is a new nonprofit co-op, consumer-operated oriented plan. We got started right here in Lewiston. We've been incorporated since 2011. 2014 is our first year of operations, and we're pleased to have over 40,000 members. Most of them on the individual non-group side of the landscape, but we're growing in our small group and large group as well. We have a variety of plans, about 10 plans for 2015 that we've put forward to CMS, Centers for Medicare and Medicaid Services, for their approval, and a handful of plans that we'll go through on the small group and large group market as well. We are awarded by Coastal Enterprises for their partnership award. We're pleased with that in particular because our mission is to partner with providers, with businesses, and with the people of our service area, in particular to provide meaningful and affordable benefits to result in not only high quality care, but good health and wellness as a result.
Kevin, you're on. Make your pitch. Why are you the best choice for me?
Great. Well, I'll start with strong benefit design. Ed mentioned whole cardiovascular disease, and I'll just say that we're adding coronary artery disease, cardiovascular disease to our chronic illness support program. So now we have 5 conditions that we provide reduced, greatly reduced cost sharing for our members. So diabetes, asthma, COPD, emphysema, hypertension, now cardiovascular disease. So office visits, generic drugs, lab, DME related to the management of those conditions are at no cost to your employees as members of Maine Community Health Options. I also mentioned in terms of benefit design, first 3 behavioral health visits and no charge to the member, regardless of plan, except for the HSA plans. And I'll mention those in just a minute. That's really to reduce the stigmatization and the barrier, financial barrier to getting into behavioral health, which we know if someone is newly diagnosed with a chronic condition oftentimes means the ability to adhere to that care plan. And lots of good reasons for getting into behavioral health. And so it's a really nice adjunct to the EAP program that many of you may be familiar with. Another strong component of Maine Community Health Options is our broad network of providers. We span the entire state. We really believe that access to care is essential for access to coverage to be meaningful. Another piece I'd mention is our excellent service. Our member services is right less than a mile away from where we sit right now. Right here in Lewiston. We're pleased to have a very professional cadre of people taking calls from across the state each and every day. We have a great business development team, many of whom are here right now. I hope you get to meet between Bob Garrett, Patrick Hamlin, Christy Pendexter, Mary Whitaker, and of course I want to mention Rob Hillman, our Chief Operating Officer, so please take a moment at the end to meet with them. And lastly, I just mentioned quickly our mission-driven nature, that we are a nonprofit as well. We are a nonprofit that is directed by our members. So we are holding elections by our members, and more than half of our board will be comprised of our members. So people in this room who are members, or your employees who are members, are eligible to not only to vote, but then to also stand for a director role within the Community Health Options. It's a very powerful accountability measure that was very purposeful in the setup of consumer-operated oriented plans.
Great.